registered dietitian and a licensed mental health therapist. I have my degree in nutrition, and I've been practicing dietetics and have been a registered dietitian for 36 years. And that degree is from University of Wisconsin-Madison. How many people from the Midwest do we have here? Anybody? All right. So, go Badgers. Anyway, I also have a degree, thank you. I have a master's degree in mental health counseling. And I combine the two. I say I treat the gut and the brain because then it's all working together. Okay. So we're going to talk about medical nutrition therapy. Now, how many of you have seen a dietitian? One person? Two? Okay. So, nursing homes, if you get into a nursing home or a hospital, guess what? By law, you have to see a dietitian. And a dietitian sees you. But that's not doing preventative care. That's doing care to help keep you going at that point in time from a nutritional standpoint. And I'm thinking, so why do people not seek out this nutrition counseling before they get into a nursing home? So what we do from the perspective for nutrition, if a person does not eat enough, the fix is giving them supplements. And as you know, if you're taking care of people with Alzheimer's, one of the things that goes is the appetite or the ability to swallow. And so we're going to start chew, and we're going to talk about that a little bit. And if the person cannot feed themselves, is that better? No? Hold it like that? Okay. And if the person cannot feed themselves, then they need someone to feed them. And you know what? This is something so beautiful. I opened Veterans Nursing Home in 2004, and I still had that contract. And one of the things that I think is so tender is that I see the wives coming in to feed their husbands. And I will tell you that those men who have their wives coming in to feed them, they last a long time. They may be on hospice, but they're going for maybe a year beyond what they're supposed to be living. And that is just because it is such an intimate, nourishing, they're feeding their loved one. And then the other thing we look at, I always say, like everybody doesn't want to eat fattening foods now, although we're going to talk about that. But what we do, it's okay, it has to be calorie worthy. But anyway, we put, instead of mashed potatoes with skim milk, we'll do mashed potatoes with cream, whole cream, and butter, because every bite counts when somebody has Alzheimer's dementia. Every bite counts, and if they're going to eat only 2 bites full, well, I want to make for sure that those calories have enough in it, like they were eating a half a cup full. All right, but now this is about the caregivers, right? So what about you? Because we have to have one person online to be taking care of the other person who's offline, right? So what we're going to talk about for you is diabetes. Kris, is there like a light on this?
Yeah, right in the middle. There's a little,
oh, there we go. We're going to talk about diabetes, obesity, insomnia, isolation, lack of exercise, and inflammation. Because I am telling you right now, a lot of this is preventable. I'm telling you right now, type 2 diabetes is totally preventable. Totally. All right. And here are the stats on diabetes. We have 9.3% of the population has diabetes. Diagnosed is 21 million people. Look at this undiagnosed. 8.1 people are undiagnosed. So in my practice, we tell you if you're headed that way, because we don't just look at blood sugar, we look at fasting insulin, because fasting insulin is going to tell me if your pancreas is working overtime. You can have a normal fasting blood sugar, but you can still be pre-diabetic. And most blood tests do not look at fasting insulin. And also, when it has come back, when I checked it, the Quest labs say that it's 12 to 24 is normal, And from a functional standpoint, I'm looking at that being less than 7. Because then we know that your pancreas is okay. You're not taxing your pancreas. All right. High glucose levels are going to be, you know, when people come in and say, oh, I'm just a little bit diabetic, I'm borderline, I always say, you know, you need to be concerned about that. Because high sugar levels are going to impact your body. It's going to impact what your, how your blood flows. So this was in the New York Times, and this is how the sugar industry transferred the obesity blame to fat. And this was like in the early 60s when they were coming up with the food guide pyramid and all the regulations. The sugar industry, and this is all documented, the sugar industry paid 5 Harvard researchers to do research to say that it was sugar that caused heart disease, or I mean, sorry, it was fat that caused heart disease and not sugar. But now we know it's quite the opposite. It's the fat that causes, it's the sugar that causes the heart disease. Excuse me, it's the sugar. I don't have my notes up here. Anyway, and how this does it is that if you have high blood sugar, it binds to the protein in your veins. And it's called glycation of protein. And when I read about this, I suddenly realized why in diabetics I can never get the protein up. It's very difficult in diabetics to get the protein up. If you have high blood sugar, that sugar is combining with the protein, making it less bioavailable. And so how many of you have ever made fondant? Anybody? Okay. And what is in it? It's made with sugar and egg whites, right? So you have sugar and protein to make the fondant. And that is what is going on inside your veins. So it's the sugar. All right. And this is going to then impact the circulatory system. And guess what? Heart and brain, if your heart isn't pumping and you don't have clear veins, you're not going to be getting blood flow up to your brain. And if you're not getting that blood flow to the brain, guess what happens? Your brain is not able to send the messages to your feet. My brain is telling my feet to go like this. Your brain is not sending the messages to your fingers, dropping things, that sort of thing. Numbness that's coming from the neuropathy. Okay. And then obesity. I check C-reactive protein, and we're starting to check some other indicators of inflammation in the body. And if you have this high inflammation, it's like your brain is on fire, you know, because you're just inflamed all over. And then the other thing is you have inflammation in your joints. And I learned this, I heard a physical therapist speaking. And so 1 pound weight loss takes 4 pounds of pressure off of your joints. Wow, wow, isn't that amazing? So, all right, now getting back to blood flow. Why you need blood to flow to your brain, because and also all over your body, it's carrying nutrients. And these nutrients help your brain to function, and that helps you to have a neuroplasticity. You had neurologists who were speaking to you, and I'm sure they were talking to you about this. I love this picture because when you have to eat the rainbow. Eat all different foods, because the different foods have micronutrients in them and phytonutrients, and this is all going to be good for your brain. How many of you have heard of diabetes type 3? Okay, so can somebody tell me what that is? It's type 2 diabetes, and in 2008, the National Institute of Health knew about this in 2008. 2008 paper was written that type 2 diabetes causes brain insulin resistance, because you have to remember, it's systemic. If you have tingling in your feet or tingling in your fingers from neuropathy, you have it in your brain as well. Cognitive impairment, oxidative stress, and so the insulin resistance can account for the tangles and the bundles in the brain. So they concluded that type 3 diabetes accurately reflects the fact that Alzheimer's dementia represents a form of diabetes. Now, is this true in every case? I'm sure not. But I do think that it contributes. So, what do you all need to know about this then, right? So, there are non-pharmaceutical treatments of type 2 diabetes, and one is 360 milligrams of oral magnesium after 4 to 16 weeks to reduce fasting blood sugar, and whoops, let me go back, it increased HDL. I talk about the HDL level, you want that to be high. That's not the blue light special. If you think about LDLs and HDLs, they collect the cholesterol in your veins, and the LDL is kind of like the blue light special, but HDL is a Hoover vac, and the HDL is collecting all of the cholesterol and not allowing it to be available for plaque formation. Okay, so magnesium. Even if you're on metformin, guess what? Take some magnesium. Eat low glycemic foods, non-processed foods. I always say, the longer it stays on the shelf, the longer it's going to stay in your body. So if you can eat more whole foods, and I'm not talking about shopping at Whole Foods, or they call it whole paycheck. I'm talking about going to the farmer's market or going to the grocery store and getting fresh fruits and vegetables or frozen. Try and pass by the canned goods, although you're going to use probably canned tomato sauce and all of that sort of thing, which is fine. But do you know that frozen vegetables actually have more nutrient content in them than fresh? Wow. And the reason is because they are picked at the farm or whatever, wherever they're doing all of the growing the vegetables. They are picked and frozen right there. And so you have all much more nutrient content then because it's flash frozen. All right. Now, I have people come in and tell me, oh, if I eat a cookie, I'm going to gain 5 pounds. And I'm going to tell them, you know what? That's not true. Or I have people come in and tell me they have a nutritious shake for breakfast, they eat a salad for lunch, and they only have vegetables and meat for dinner, and they eat nothing after dinner. And then I calculate what their body weight is compared to, I do a calculation of what they're actually eating, and they go, oh, I didn't know I was eating that much. So, oops. All excess energy turns to fat, and it has nothing to do with only eating meat. There are a lot of people, January 1st, I'm sure a lot of people did the Atkins diet, and I did a whole support group on that. So if you're eating high amounts of protein, you're going to gain weight. If you're eating high amounts of a half a loaf of bread and that sort of thing. It's not just carbohydrate, it's everything, and it's not just fat, it's everything together. So carbohydrate has 4 calories per gram, protein has 4 calories per gram, and fat has 9 calories per gram. So an apple essentially has the same amount of energy in it as a teaspoon of butter. So everything, it's all excess calories. And so what you want to do is you want to eat from the 5 food groups: fruits and vegetables, some breads and cereals, which do have carbohydrate, but you need, need carbohydrates. So the thing is, if you have a high amount of adipose tissue or fat tissue, if you are obese, yes, we are going to really limit the carbohydrate in a meal plan. But once you lose that adipose tissue, you don't have the extra energy, because all fat is extra energy. That's all it is. So once you lose that extra energy, guess what? You need to eat some carbohydrate. Otherwise, to get the blood sugar, your body is going to break down the muscle mass. And if you break down muscle mass, you are actually reducing your basal energy expenditure. And what that is, essentially means how much you can eat. So, milk and dairy products, and foods that contain fat, and then meat, fish, and the protein alternatives. Eating everything together is very, very important. Oh, and that's the other thing. I have a lot of people, and they say, oh, well, I only eat my fruit. I don't eat my fruit with vegetables, and I do this and I do that. And I don't know what book is out there or who it was written by. But the whole thing is, if you're having fruit, you need to have either peanut butter with the apple, or a slice of cheese with the pear, or a little yogurt with the orange. And the reason is because if you're just eating carbohydrate, it's gonna go in, it's gonna be absorbed, and it's gonna raise your blood sugar. But if you have a little fat and protein with it, what happens is that it kind of coats the stomach and it reduces gastric emptying. So you stay full longer, and you don't have a rapid rise in blood sugar. All right, now, getting back to the people that you take care of. What happens when chewing declines? Well, we start with a mechanical soft diet, which is going to be ground meats, hamburgers, hot dogs, luncheon meats, that sort of thing. Scrambled eggs, mechanical soft or chopped foods. And if they cannot chew, if they still get that, it's called pocketing. If they can't chew enough, and it gets pocketed in their mouth, then you need to go to the puree food, or like the baby food. So this is a slide that has dental soft versus mechanical soft. And you can see things like Cheerios and cereals. What happens is you put milk on it and it starts to break down. So it's easier. We call that a slurry. You can take a piece of cake and put milk on it, or if you had orange cake, put some orange juice on it, and that starts to break down and make it very moist, and we call that a slurry. And it's easier to slide down. Soft cooked vegetables, so you're not going to be giving carrot sticks to somebody who's lost their ability to chew and swallow. Fish and meatloaf. Again, meatloaf is something that's ground, and you can pack that full. You can add, eggs to that, and try and, what I said before about fortifying foods, you want to try and add extra calories wherever you can. Because if you get to be frail and you have no more reserves, the decline is going to come faster. All right, mechanical soft diet, problems maybe with the teeth or from a stroke, head or neck surgery. The only change in diet is the texture. If they are diabetic, we would be still limiting the amount of carbohydrate. Soft cooked vegetables, applesauce, pureed fruits, that sort of thing, or canned fruits. If they're diabetic and you get canned fruit, make for sure that you rinse the syrup off of it. Soft breads and cereals, puddings and custards are very good as well. Pureed vegetables, this is like the texture of the pureed food. And then we have supplements. So you can add ice cream to any supplement, and you're gonna boost the protein and the calories. So you can just blend it all together. Now I have so many people say, well, my mother drinks a can of Ensure every day. And I always say, well, you know, you can give her a glass of milk, it's a lot cheaper, and she gets the same amount of protein. So, so you can take almond milk if they have a dairy allergy, or you can take, you know, just really any sort, or you can take whole milk. Always whole milk over skim. Because remember, it's not the fat, or I mean, it's not the fat that's causing the hardening of the arteries, okay? It's the sugar. So use liquid vitamins, and you can mix that in pudding, and then use sour cream in every recipe that you can. Phil isn't here, but we have a local man who has come up with this formula. It's called Weight Gain Smoothie. He only sells it right now online in these big containers. We're trying to get it into veterans, and to do that he has to package it in individual packages. You can look it up online, Weight Gain Smoothie, and you can order it from him. But you can take this and add a scoop of ice cream to it and milk. You're gonna get over 500 calories with 40 grams of protein in it. So you can just supplement 2 of these a day, and guess what? They're gonna have half of their calorie needs met just in the supplement. All right, so when swallow declines, you can try some carbonated beverages, see if that works. Add some thickener to the beverages, but this is out of my scope of practice. So I just know what the speech therapists do at veterans. Ask your doctor to have a speech consult so you can find out what level of thickness. Is it thin liquids, nectar thick, honey thick, or pudding thick? Because if they're taking thin liquids and they're having swallowing problems, they can aspirate, and then they're gonna get pneumonia, and that's gonna be a hospitalization. So this is something, you know, to look at. So if they're taking thin liquids and they're coughing, you know, if they're coughing, that's a sign that you probably should have a speech consult. All right, now, reducing inflammation. And we want to do that by making for sure that you have good pre and probiotics. So the prebiotics is going to come from non-soluble fiber and soluble fiber. And then you have the probiotic that can come from yogurt, a multi-strain yogurt, or you can buy them over the counter. I put this slide in here because, you know, probably about 10 years ago, the Florida Dietetic Association has a meeting every July, and people come to it from all over the country because they get outstanding speakers. And there was a gastroenterologist from Johns Hopkins that spoke 10 years ago, and he was telling us about gluten. And we're thinking, okay, well, you know, 10 years ago, it's like, it was kind of on the radar, but, you know, really, we're still thinking it's celiac disease. No, it's not. Not what this doctor said is that not one human being has the enzyme to totally break down gluten. And so what happens then is we get the gluten is gets in between, it's absorbed through your brush border in your intestines, and then it's a big molecule. So how does your body deal with foreign substances? It sends out the army to break them down, and that's what causes the inflammation. So we talked about the microbiome and the probiotics and the prebiotics, and then there are also flavonoids. And these are the flavonoids in the food, and that's why I say eat the rainbow. Eat the rainbow, because you need a lot of these different food components. And these are found in whole foods, not processed foods. Just smell the coffee. Coffee is good for the brain. Now, if you have, you know, if your doctor, because if you have rapid heartbeat or something, they say drink decaf, you need to do that. But if you don't, coffee is good for the brain because it stimulates the brain. Fat is not a dirty word. And this goes back to that sugar, you know, where the sugar industry paid the 5 Harvard researchers to say that fat was bad for us. This is why it's not. Because fat, your brain uses fat, and your brain has something called a phospholipid layer. And that phospholipid layer is made up of, guess what? Omega-3 fatty acids. So that's why eating good fats is important for you. So brain food supplements, omega-3 fatty acids, folate, vitamin B1 thiamine, which you can get in a good multivitamin B complex, vitamin B12, but you need to, if you're over 50, we start to, you need something called intrinsic factor to absorb the B12. And so if your vitamin does not have the intrinsic factor in it, then you need to make for sure that it's sublingual. Vitamin E and alpha-tocopherol and the mixed vitamin E family, calcium and zinc, are all important for the brain. So this slide I like. It's very busy, but it shows how nutrition slows dementia. So we have the minerals, the plant flavonoids, which I showed you the picture of, omega-3 fatty acids, vitamins, the metabolic substrates, and antioxidants. So these are the metabolic substrates are going to be, you know, really your food that you're eating. The other thing I want to tell you, so we mentioned about omega-3 fatty acids. In meal plans that I do, 20% of the calories are from the fat calories. Excuse me. Excuse me. Oh. Okay. Okay, thank you. So, all of the fat, so 20% of fat calories we allow in saturated fat, because guess what? Your brain runs on cholesterol. Cholesterol is a good food for your brain. And if you're on a statin, if your doctor doesn't have you on CoQ10, you need to be on it. All right, medium chain triglycerides come from coconut oil, or you can buy oil that is medium chain triglycerides. It's also as good for the brain food, or fuel for your brain, and because it goes directly to your brain. And what else do you need besides eating? You need good sleep, because your brain repairs itself. It clears those bundles and tangles if you get a good night's sleep. Exercise, use it or lose it, and believe, hope, dreams. This is very important, because if you have something to look forward to, like coming to Chelsea Place, dancing with the people, having your hair done. Kris showed me a video of what's going on here. Amazing. So if your loved one who's declining has something to look forward to, guess what? Hope, belief, hope, dreams. Very important. Attachment and touch. And this is why the vets who are on hospice and their wives come in to feed them, it's why they get an extra year or more of life. And that is why nutrition is important to delay dementia. And if you have questions, I'll take them in the back. In the hair salon. Thank you very much.